Hello, my name is Mary Lawson. I am a board-certified family practice nurse practitioner and Doctor of Nursing Practice student at the University of South Alabama. I will be conducting my virtual presentation about my Doctor of Nursing Practice project titled Quality of Life Impact of Early Integration of Palliative Care in Advanced Cancer Patients with Diabetes mellitus. This project was completed in partial fulfillment of the requirements of the Doctor of Nursing Practice degree. I would like to offer thanks to Dr. Nancy Turnham for her guidance throughout this journey to complete my doctoral project. I would also like to thank Dr. Mary Raven, the palliative care physician who mentored me and guided me throughout this project. And finally, I would like to offer thanks to Alice Batista, the Department Director for the Palliative Medicine Service in Baton Rouge, Louisiana. Her support and guidance was crucial throughout the implementation of this project. I am grateful for the support, advice, and guidance that I've received throughout this whole journey to achieve completion of this doctoral project. Over the last few years, several studies have proved the positive impact of palliative care on quality of life and patient outcomes. Palliative care is a specialized form of health care focused on improving quality of life in patients with advanced illness. More than 11 million people in the United States are currently living with advanced cancer, and more than 90% of patients with diabetes and advanced cancer will experience complex and escalating symptoms. Common symptoms experienced include pain, nausea, vomiting, fatigue, dyspnea, anxiety, and depression, and more than 60% of these patients are referred late in the disease trajectory to palliative care. With more than 11 million people living in the United States with advanced cancer, healthcare costs can escalate rather quickly. An excess of $17 billion is spent annually in the United States on healthcare alone. And more than one-third of Medicare patients with advanced cancer will experience death in a hospital with numerous aggressive and costly interventions. Escalating healthcare costs, excessive symptom burden resulting in poor overall quality of life, and an increasing number of aging population living with advanced cancer, diabetes, and other advanced illnesses are significant contributors to the need for earlier integration of palliative care. The purpose of this evidence-based quality improvement project was to establish a single standardized method to evaluate quality of life in patients with advanced cancer and diabetes, referred to palliative care. The goals and aims of the project were to accrue 10 patients to participate in the project, establish a validated tool to evaluate symptom management and quality of life in patients referred early to palliative care, and ultimately positively impact the overall quality of life in advanced cancer patients with diabetes referred to palliative care through aggressive intervention and earlier integration of palliative care. Methods. Subjects consisted of a convenience sample. The inclusion criteria was a diagnosis of advanced cancer, stage 3 or 4, and diabetes mellitus, and significant symptom burden impacting quality of life. Exclusion criteria included absence of a diagnosis of advanced cancer or diabetes mellitus. Project participants were male and female adult patients. The setting for this project was an outpatient palliative care clinic affiliated with a local acute care hospital in an urban area. Clinic hours were 8:30 a.m. to 5 p.m., sometimes extending past that, on Thursdays and Fridays. The FACET SP tool was the questionnaire used for this project to evaluate quality of life. It's a 46-question self-report tool. It covers physical, emotional, and spiritual areas that might impact a patient's quality of life. Tool validity and reliability has been demonstrated through numerous studies over the years. Blood glucose levels were also evaluated with each patient visit. Analysis of results. The results were reviewed at the time of the patient's visit with the palliative care physician, palliative care nurse, the DNP student, and the patient. Results were recorded weekly by the DNP student. Histogram charts were used to trend and track results to evaluate them on a per clinic visit and as well as weekly results and then throughout the course of the project. Ongoing communication occurred regarding results and preliminary as well as final results from the project throughout the project. Results of the project. A total of 24 patients were accrued through the course of this project. 16 males and 8 females, adult patients, age ranging 26 to 91 years old. The most common physical complaints included pain, nausea, fatigue, and the most common emotional complaints included sadness, worry about death, and nervousness. A total of 24 patients completed the initial questionnaire, 18 patients completed the first follow-up questionnaire, and then a total of 16 patients completed the second follow-up questionnaire. With the initial visit, what was demonstrated in the questionnaires was 17 out of 24 patients admitted to moderate to severe pain, and 10 out of 24 patients were not satisfied with their current quality of life. And on this slide, you'll see a graph of the initial visits demonstrated in a histogram format. It does show fairly significant pain, fatigue, and nausea. During the first follow-up visit, 1 patient admitted to moderate pain, no patients admitted to severe pain. 9 out of 18 were moderately satisfied with current quality of life, and 4 of the 18 were very satisfied with their current quality of life. 1 patient was admitted to hospice after completing his first follow-up visits. No significant changes were discovered related to blood glucose levels. On this slide, it demonstrates the results that we just discussed. There were significant changes in pain and quality of life satisfaction. During the second follow-up visit, no patients admitted to moderate to severe pain. All patients were satisfied with their current plan of care and their degree of pain management. 9 of 16 patients were moderately satisfied with current quality of life. 7 patients were very satisfied with their current quality of life. Throughout the course of this project, no significant changes were noted related to blood glucose levels. And on this slide, it demonstrates in histogram format the improvements in symptoms with regards to pain, fatigue, and nausea. In conclusion, the FACET-SP questionnaire is a standardized tool that may be used to provide a mechanism for evaluation of quality of life and overall symptom management in advanced cancer patients with diabetes referred to palliative care. Results demonstrated a positive impact on symptom management and the quality of life with integration of palliative care over the 4-month period. Additional research and use of evidence-based interventions related to the impact of palliative care on patient care is needed as we move forward in the future.